In October 2025, the European Society for Medical Oncology Congress was held in Berlin. For 5 days, healthcare professionals from around the world gathered in the German capital for the latest in oncology research. Here, we present a recap of just some of the noteworthy genitourinary oncology data unveiled at ESMO 2025. One of several bladder cancer highlights at ESMO 2025 was the presentation of data from the Phase 3 Keynote 905 trial from Dr. Christoph Volstecke.
So regarding event-free survival, there was a very early and sustained separation of the Kaplan-Meier curves, and this was translated in a statistical significant hazard ratio of 0.4 in favor of the intervention arm of infirtumab vedotin and pembrolizumab. And if you look at 2 years, for example, the event-free survival in the control was 39%, and in the intervention arm it was 74.5%. So this was quite striking. And then for overall survival, it was also a hit. Also very statistical significant, hazard ratio of 0.5.
Another noteworthy bladder cancer abstract came in the form of Checkmate 274. Dr. Matthew Galsky presented 5-year data evaluating adjuvant nivolumab in the treatment of high-risk muscle-invasive urothelial carcinoma.
The key findings were that with extended follow-up, 5 years of follow-up, there is a sustained benefit of adjuvant nivolumab versus placebo for disease-free survival in both the full randomized patient population and in patients with tumors with high levels of PD-L1 expression. We did some exploratory analyses because urothelial cancers arise most commonly in the bladder. The study enrolled patients with upper tract urothelial cancers as well as bladder. So we looked specifically at bladder. And if you look at patients with bladder cancer treated with adjuvant nivolumab, the benefits are apparent in that group as well.
Meanwhile, in prostate cancer, Dr. Stephen Friedland presented compelling overall survival data from the Phase 3 EMBARK trial evaluating combination treatment with enzalutamide plus leuprolide.
The key finding is that enzalutamide plus ADT reduced the risk of death from any cause by over 40%. Relative to ADT alone. Really practice-changing, practically unprecedented survival advantage for this stage prostate cancer with a 40% reduction in the risk of death. With enzalutamide by itself, though we saw directions suggesting survival benefit with a 17% lower risk of death, did not reach statistical significance.
Dr. Luis Costas presented data from the Phase 1-2 Alphabet trial of combined radium-223 and lutetium-177 PSMA INT in patients with mCRPC. Here, she discusses the background behind the study.
So the whole rationale behind Alphabet is that if we add in a bone-specific alpha emitter to target that osseous disease, hopefully this will result in better treatment or eradication of the disease in the bone. And this is because alpha emitters compared to beta emitters, they have a higher linear energy transfer. So they're more likely to result in a double-stranded DNA break and kill the cell without relying on that surrounding crossfire radiation, which you don't necessarily get in micrometastatic disease.
In kidney cancer, Dr. Katie Beckerman, who presented a Phase 1b/2 trial of ipilimumab, nivolumab, and ciforadenant in first-line advanced RCC, explained that adenosine signaling in biology is complex and that blocking a single receptor may not be sufficient.
I think it's going to be complex, just like all biology is. And so this molecule blocked really just one of the receptors. I think, part of the question is, if it's such a strong signaling biology, perhaps additional blockade is required. There's a beta receptor, maybe we need dual blockade of both receptors. Maybe we could target the enzymes that digest ATP to adenosine, maybe again, just kind of dual targeting. I think there's a lot of excitement still about adenosine signaling and lots of preclinical data and mouse modeling to suggest if you can modify that. So I think we just haven't quite figured out, the right way to do that. We're going to go back on our part and do some additional correlative look, to understand maybe it's not just the adenosine signature. Maybe it needs to be the adenosine plus a T cell, some different, more exploratory looks to see if we can find something that does find which patients are the responders.
For all of our ESMO 2025 coverage, visit www.urologytimes.com. Take care, and thanks for watching.